medical partner is Fortis Hospital, Jaipur. Do we have Mr. Kulshreshtha, corporate team, can you with us? I request Mr. Shashwat to please join us on stage. I request Mr. Gautam Patel, Senior Policy Manager, Jain, to join us here on stage. Mr. Sumanta Ray, Chief Marketing Officer, Narayana. And I think Mr. Balaji, Utla, Narayana, if he can also join us. We have a paucity of time, we are running short of time. So I'll request Honorable Chair, Mr. Naveen Jain, to kindly try to wrap this session within 1 hour. And there's only one presentation by GVK, otherwise we have a panel discussion. Can we start with GVK's presentation, sir?
Good evening, honorable gentlemen and the panelists, and also dignitaries of the audience. Here, I thank you all for providing the opportunity to EMRI to present their success stories, which is a combination of both PPP and the CSR. While GEK funds the CSR initiative through their CSR initiative, the EMRI, Emergency Management Research Institute, which runs various services like 108, 104, and 100, and other mother and child care and other services. The pioneer in this one is 108 ambulance services, which we are running in 15 states under the public-private partnership with various states. So let's start this one, the innovative program PPP, not-for-profit partnership service delivery model to provide emergency response services at Rs. 1 per citizen per month. We serve one emergency for 4 seconds and serving one life in every 5 minutes. How it started? 75,000 emergencies occurs per day. Out of 90% are bottom of the pyramid, which don't have access to the, reaching to the timely to the hospital. And 80% of deaths occur in the hospital in the first hour itself. 4 million deaths per annum, which mainly is cardiac, road accidents, mental and suicidal deaths. So what we have done through the 108 is provide access to universal toll-free number, which is the 108 number, which has now become a common brand all across India. Then availability of life-saving ambulances to reach quickly to the nearest hospital. Then affectionate care by the trained paramedics. And affordability by every citizen independent of income, religion and community. Hence, GVK EMRI was born in April 2005. What is the vision? We have a 30 million to respond to 30 million emergencies and save 1 million lives annually to deliver services at a global standards for leadership, innovation, technology, research and training. Here, the effort or the contribution of GVK comes as a CSR partner in this one. What is so unique? Integrated emergency response services of medical, police and fire emergency with single universal toll-free number 108. A lot of people think it's only for the medical emergencies, but we actually include the police also and the fire also. And it's free service, no cost to the citizen. It works with the KPP work framework. Here we work with the government of Rajasthan, and thanks to sir, that there are 741 ambulances we are working for the last 2 years. Private partner bring leadership, innovation, execution and technological capabilities and conducting research and training capabilities in emergency medicine. Just as a snapshot, we have projects. We have Dial 108 project, then we have Janani Sishu Suraksha Karyakram, which is commonly known as the 104 here, then we have Dial 100, then 181, the Women Health Line, which we are running in Gujarat, mobile medical units, then 104 healthcare helpline, and also mother and child traffic facilitation centers. We are working now in 17 states and union territories put together. And total we have right now 10,000 ambulances, and we are roughly handling 36 million emergencies per annum, and total life saved so far is 14 lakhs. And we have employed 41,000. We are giving employment to 41,000 associates. How it works? This is somebody can simply call the 108 ambulance, which is you can see on your website. Then there's a modern, spacious and open ERC center, emergency response center, where the call lands. Then through GIS and GPS, this is a technological combination through which the ambulance is directed to that particular patient. Then ambulance reaches there and it takes care of the patient and sends timely to the hospital. And in between there is a doctor which gives a telemedicine kind of advice that okay, what kind of medicine while reaching to the hospital which can save that particular life in that particular, which is done by the EMRI. How it works, the combination. There is a political will, public servant commitment and public support, which is required. That's how we call it a PPP. Then direct capital and operation cost by the government, which is the public for the public. The GVK funds leadership, innovation, infrastructure, process, collaborations, training, research, knowledge transfer and quality assurance. Then Tech Mahindra provides a free IT solution as a technology partner, and GVK EMRI manages and leverages government resources for better outcome to serve the poor. So this is just a matrix through which, with the help of government and the technology and also the CSR funding, we manage the complete services. The process is very simple. Through the call lines at 108, then there is a sense which is being tracked by the call center. Then the ambulance reaches on the site. Then there is a care where the patient is taken and is being served while going to the hospital. And then the most important is follow up for 48 hours so that we know what is the condition and what are the feedbacks we get from the patient so that we can improve upon all the services. This is just a schematic view. On the top you can see the Tech Mahindra which manages through which the unique software applications through which we track the telephone number, and also we track the ambulances and we provide the call lines. In between is the emergency response officer, which guides, which talks to the patient and also tries to locate the location of the patient and what is the problem we have, and that's how the ambulance is being dispatched with the help of GPS tracking, and then an ambulance is sent to a location to the hospital with the patient. How it works? Emergency medical technician in the ambulance is trained not only to provide the pre-hospital care but also to handle the emergency situation. Then immediately gets a support over phone from the ERCP, response center physician, and ERCPs are in the ERC around the clock to provide the support to the EMT. So it's an integration of technology, human interface, and also the ambulances. It works on a sense for patient healthcare. The system and processes has to be very strong. So the CSR funding is being done to ensure that most of the things are done at the heart of the institute, which is in Hyderabad, EMRI Center. So we work on process and protocol, then training, then on research, then global partnerships, and also on indigenized execution models. Because if you bring in the best practices from the Europe or UK and from the US, that doesn't mean that everything is going to work in India in a similar manner. So you have to indigenize that. These are the few of the collaborations we have at international level, like 911. Then some of them India also, like HFI, APN. Also, we are working with American Heart Institution, then Stanford University, then International Trauma and Life Support. So through this we get the the knowledge. What is the impact? We have roughly pregnancy-related cases which we handle is 35%, then regular trauma is 12%. Road accident is the second largest thing which we handle. And now we have become most of our angels of mercy and conservative ambulances. We are running in 17 states and union territories, which has become a successful. If you just look at the Rajasthan statistics, 30% of the cases we handle is pregnancy related and 18% is road traffic. And after that, then you have acute abdomen, then trauma, which is non-fecal, and then respiratory. So we had less than 1 rupee at cost. We try to impact to save lives, especially for MMR and IMR. And most of the difficult places we try to reach, be it snow, be it on any stations, be it on railway line. Also, through difficult terrains, we also have a boat ambulances. Then we have a neonatal care in Goa and in Tamil Nadu. And other services through the learning of the 108, we have, there are other services which have also integrated on the same platform. Drawback of mother and child care, then dial 100 services for AP, then 104 services in Daman. These are the few awards we got. And this has been, declared as one of the best innovation in 108. These are the few awards which have got. What we, do at the end, want to conclude is the reduction in poverty and increase in quality of life can be achieved by caring, valuing, and respecting life with humaneness, humility, and commitment to the people. This joy of giving back to the society increases the dopamine, which is the satisfaction, then oxytocin, which is attachment and mental progress, which is give the morals and the sense of pride. Thank you.
Thank you very much, Mr. Subrata. He is state head GTK EMRI Rajasthan, and really they are doing a great service to Rajasthan. I would just like to add data from Rajasthan that they receive approximately 15,000 calls per day in Rajasthan, and unfortunately, out of these 15,000 calls, only 3,000 calls are really for some service, while 80% of the calls are made. So this is also some aspect of 108 services. They are struggling with it. We are also struggling with them to control these fake calls. And approximate dispatches per day are 1,600, because every 6 hours I get an SMS from them that this is the number of calls they have received and number of the dispatches they have done. I have also seen one trend, like from 12 to 6 in the night, dispatches are less. From 6 to 12, dispatches increase in the morning, and then again 12 to 6 in the afternoon, dispatches are less, but the maximum dispatches of the day are to be. So this is a trend I'm constantly watching for last 8 to 9 months, and I think it is very clear that why accidents are more between 6 to 12. I would say 2 more things before I invite another speaker for CSR. But these 2 things, please, they are not a part of proceedings, they are on a lighter side. So they are not a part of proceedings. I'm saying it again. Somebody advised me in my childhood, lead from the front. So, but they never told me that followers can go back from the behind. So when I sat on this platform, then I put, what is this? Then second thought came from the first thought. As you go up in the hierarchy, your capacity to learn or your willingness to learn diminishes. Unfortunately, I am saying this thing for the reason that the so-called lowest order in our service, the people are sitting here since morning. जो हमारे मैं हिंदी में इसलिए बोल रहा हूँ ताकि वो लोग समझने की उनके लिए बोल रहा हूँ, जो हमारे नर्सिंग के स्टूडेंट्स हैं वो सुबह से आए और लगातार दे आर स्ट्रगलिंग के वो कितना समझ सकते हैं। मुझे तो लगता है कि मैं हिंदी बोलने वाले छोटे से शहर के छोटे से स्कूल में पढ़ा और मुझे मेरी जिंदगी में ये लगता था कि मैं IAS क्रैक करूँगा, लेकिन मेरे ख्याल से शायद ये जिंदगी में आप लोगों की बहुत मैं इस बात के लिए आप लोगों को मैं चाहता हूँ कि सब लोग इनके लिए तालियां बजाएं। आज ये नहीं कर पता चला। और मैं कई लोगों का थैंक्स करूँगा क्योंकि उन्होंने मुझे यही MBBS और PhD की डिग्री दी है, डॉक्टर जैन। But I'm a former student, I have never gone for PhD or MBBS। और पिछले लगभग 13 महीने से राजस्थान के मेडिकल डिपार्टमेंट को चला रहा हूँ, तो आधा डॉक्टर तो बन गया हूँ, बट क्वैक टाइप का डॉक्टर। सो थैंक यू वेरी मच एवरीबॉडी। और मैं आप लोगों को विशेष रूप से कहना चाह रहा हूँ, और हमारे यहाँ कुछ नए कंसल्टेंट्स ने ज्वाइन किया है। आई कैन सी देम स्टिल सिटिंग हियर। The new people who joined me just last month, they are more prone to learning. Rather than my various project directors and consultants, I think they have learned more. So they are not, now trying to learn. And this is a message for everybody. The simple reason is, you will not get this opportunity every now and then. In 13 months, this is my first conference which I have been able to conduct, despite of our very busy schedule. So I will request everybody sitting here that we should see to these things, because we never think about these things. And I will say personal thanks to everybody. Somebody came from Mumbai to tell me about the new aspect of medical treatment, that is the ritual side of treatment. And there were two people from AIMS and CTAC. Sorry, I felt very bad. We could not listen to you because of the changes which happened in the schedule. And then there are various other people who presented their cases, and now I think I will go back to the original proceedings. Now we can start recording you will start recording the proceedings again. Now I will request Mr. Tamboli, the Director of Fortis, Jaipur, to say what you want to say on the CSR side of the medical industry.
Well, good evening everybody, and thank you, Chairperson Shri Naveen. I must compliment that this initiative would go a long way to establish Rajasthan on the global map in healthcare as well. Rajasthan has been famous for forts, and the strength of the fort, I think, will be able to make a great amount of initiative in medical health services as well. Well, if I talk about today's agenda, I would like to express a couple of points and share my experiences, and then I'll request my other colleagues to share their views. See, CSR per se, if I say leveraging CSR, I'm sure that CSR being born a few months back or a few years back, and the government of India took as a policy to have corporates, companies to contribute 2% of the profitable income to the CSR. I think earlier it was philanthropy. We in India always used to contribute towards philanthropy, and later on, when it comes into regularization, it became CSR policy as such. What is corporate social responsibility is something which I would define as something which is very sustainable. It helps the organization to meet its objective with investing for a long term in the same industry where it could be preferably. If not, fair enough, it can make a better ecosystem, should help the society, the environment, and the main objective, which is continuing to benefit to the society. Now, as an organization, we have been doing a lot of work in the corporate social arena, but what we have not been doing is defining and putting the structure till a few years back. Let me comment on some of the key initiatives what as an organization Fortis would have done. We started with Saksham, which is like a few minutes back, Mr. Suzuka was saying about a number of deaths which occur, and they had an objective of out of 30 million deaths, if we can prevent 1 million, and they were very close to 9.96 million deaths. The idea was that if you can prevent a life, and we came out with a program called Saksham, which is providing a basic life support training, which is mandatory in developed countries. When I say first aid responders or ELS training program, we imparted this training program to first responder. Could be a policeman, could be an auto rickshaw driver, could be a truck driver. In last 2 years, we've been able to do these sessions of 40 to 50 people who would come to our hospital. We impart them training on the dummies, which are responsive. I mean, they are just not dummies, they would respond whether you will be able to do a good exercise on me or not. And then we go it forward. So over close to 4,500 people have been trained for saving lives for future. So we join hands with you, sir, in saying that If there is an accident, somebody can save life and become a doctor for some time and can, in that case, could refer the patient to the right destination. Naveen is an initiative where we all know that the gender discrimination in Rajasthan and Haryana. So we started celebrating the girl child birth in our hospitals. Over network, we are able to contribute over 26,000 plants being presented to the families, and we give it to the mother saying that so the girl child would grow, so is this little tree, and would help you to have the nurture of the family, would give you great fruits, and surely would make your ecosystem more presentable. Another initiative was, in India, we have a large amount of babies who suffer from congenital heart diseases. We created Fortis Foundation in 2006, and alone in Jaipur hospital, we would have done over close to 400 pediatric cardiac surgeries, which is absolutely on the cost basis. What I mean to say is when it comes down to our hospital, whatever the drugs and principles they will to be bear the cost and let the patient go from all across Rajasthan, Gujarat, or whether they're coming from Haryana. Umeed is an example where we joined up with government, and wherever we find especially privileged children, which they are, for example, especially privileged, we do their preventive health checks and get them ready to face the future as well. Samarth, with State Institute of Family Health Welfare, we educate our budding doctors, and they come over to our hospitals and they are being trained on how to handle emergencies in ICU setup, or we talk about emergency in neonatal areas where it could produce some amount of equipment, saving lives in neonates, and as the main objective of MMR and IMR improvement in our MGDs of the Millennium Development Goals, we started working on this, and probably I would say that there is some amount of work being done. Though a lot is still to be done. Some years back, we started working with Government of Rajasthan Department of Women and Child Development with Anganwadi Sahayogī Yojana, where the doctors from our hospitals would travel down to these clinics with far off distances and would provide treatment, preventive one, education for the expecting mother and the newborn child. Now there are most of 20-25 programs which we do across the pockets, but let me conclude with one statement, that no organization can succeed globally if it doesn't address the needs of the society or the community it belongs to. And if an organization has to be successful and sustainable, CSR, whether it is in the constitution or not, is the only way to be there, to be the answer to those solutions or those problems which are being lying unaddressed. Thank you.
Now I will request Shri Kulshreshtha, his corporate affairs in Cairn.
Thank you for calling me here. My regards to all panelists here, Chairman. Cairn India, as you know, we are an oil producing company. We are producing some barley. The oil itself is a very challenging thing, and oil itself is very intelligent. It always finds geographies which are very tough in nature. You can find it inside here, you can find it in Barmer, but you will not find it close to Jaipur or Delhi. As you know, the Barmer has many health challenges, be it the preventive, be it the hospital running. And Cairn has done a substantial amount of work on healthcare things, and our CSR effort is majorly going into the health sector. Firstly, on account of the preventive thing, the drinking water is a big challenge in Barmer. The TDS is very high, 6,000, 7,000. Many TDS related bone diseases are there. So, very first of its kind initiative across India, rather than I can say, we are in dialogue with the government, wherein Cairn will take up the drinking water supply for the Barmer, wherein we will set up around 350 water desalination RO plants with spoke and hub models, and this water will be supplied to all households up to their tourist time. I think this is one of the key initiatives which will happen in the next couple of years in Barmer. On account of further preventive health, the menstrual health is a big problem. The methods used for sanitation for menstrual health was very rudimentary. And Cairn and its initiative has firstly done a sanitary napkin unit in Bargain, which is making a napkin at a very affordable cost. And as I understand, very soon the NRHM is going to buy the napkin from that unit. Further to this, the total open collection is the main problem. And on account of sanitation, we are getting entered with the government of Rajasthan, and we are building some 20,000 household toilets. This is the first of its kind program where in Rajasthan, in CSR initiative, somebody is building 20,000 households in by 2 blocks where we are operating. I think this is the preventive healthcare initiative which Jain has done. On account of, we cannot replace the government setup which is there, we cannot replicate that. But we are on account of supporting that, the entire Barmer hospital hygiene, its cleanliness, we have taken over. There was a big medical waste dumping site within the campus of the hospital, which we have entirely developed, and now there is a park on that place. Being with this initiative, I believe the MMR rate, which was the second highest, still the second highest, but the figure has absolutely come down. These are the efforts Cairn is making, but still there is a long way to go. I hope with the support of the government of Rajasthan and other our supporting heads like here and many things, we will definitely going to achieve that. Thank you.
Thank you very much, Mr. Kulshreshtha. Now I will request Patel, the Senior Policy Manager in Jaipur. He will be talking on the bridging factors of
Good evening everyone. Thank you for this opportunity. So Poverty Action Lab is a research organization, and we're very much about using evidence, moving into action, seeing impact. Normally before I talk about evidence in scientific studies, but today I heard people talk about so much that we must use evidence, we need to know what works. Then I want to give something new to this forum. I'm not going to talk about evidence today in that sense. So what will be helpful for CSR to focus on? Reflecting back to a conversation I had with Mr. Jain a couple of months back, and it's very much about implementation in the rural context as well. I think this is something we can all become complacent about. Early today I was with my colleague in Bihar, and there the flood is such that bridges have fallen down, the roads are there. This is common, it's not a surprise, but how do we get access? When we give you a rural context, how do we make things work? These solutions that we want to see the high impact in terms of healthcare. So I'm not going to talk about one of the studies we did in Utla, which was about immunization. The end line of the study was, we're trying to get people to take a full round of immunization across a year. A woman or a father have to walk maybe 1 or 2 kilometers in the heat of the rain to get their child immunized. Who doesn't like immunization? So initially we think as long as we get the leaflets, we do the radio broadcasting, please get the immunization done. Every single Friday the campaign is there, we think everybody will get their child fully covered. So it wasn't the case. That's like a big surprise. This is again how evidence helps us in the rural context. Why is it not working? Mr. Jain is always asking us, make sure your model works in this remote rural place. So this I think is one of the biggest questions we have in terms of CSR, making trust issues well. So then one thing we tried was we gave people a kilogram of blood for every immunization, and it's still highly ovarian. And suddenly immunization jumps up. But this does not mean people don't value the lives of their children if they want blood. This is actually the economics of procrastination. So today as I sit here, I can tell you that I haven't paid my electricity bill. It's been 3 months. And then when I live in Utla, so soon I'll get a pink paper slip, I'll get a red paper slip, and someday I'll pay my bill. But what I'm trying to say here is that in the rural context, we should think how do we make these micro changes in implementation work. So the solutions we have, we already have, we're adapted to that. So my contribution today is that also in CSR. In Jaipur, we share our knowledge, all our findings. We're very open to partner with anybody and collaborate. We don't charge for that. Everything we found out over the years, we've got over 100 cities in India. All those findings and those micro changes in rural context, we're very happy to share that with anybody in CSR and government as well. So we make things work in rural context.
Thank you, Mr. Jain, for having me here. Good evening, everyone. I come from an organization where CSR has into CG and Narayana, since Mother Teresa was one of the inspirations for Dr. Denisha, she founded the organization. In the Rajasthan context, I'm coming from Bangalore. So in the Rajasthan context, I would like to share a few things. Though we have a hospital here in Jaipur, but apart from Jaipur, also in other places where we have been doing certain activities and on the CSR front, and which probably, I don't know if they can be replicated or not, but there could be some learnings out of that. So when we are looking at CSR, the way we approach CSR is it is about affordability and accessibility, right? Like Dr. Shetty always said that a solution is not a solution unless it is affordable. If a large number of people cannot afford that solution, it is not a solution at all. So one of the initiatives which we have done a few years back is a micro health insurance scheme for farmers in Karnataka, which was an idea floated by our organization and subsequently adopted by the government of Karnataka and is now administered through a trust, where all the farmers who are part of cooperatives in Karnataka pay 18 rupees a month for access to 2,600 surgical procedures across all network hospitals and all major corporate and non-corporate hospitals in Karnataka. So that is a model that has been very successful and has supplemented the government in its own healthcare schemes. So, insurance or micro-insurance of providing the cost of healthcare over a large mass of people is something probably, states like Rajasthan could look at. The other thing is about accessibility. The obvious paradox in India is that 70% of doctors are there in urban India, where 70% of patients are there in rural India. So how do you reach, how do you ensure that people in rural areas, people in inaccessible areas have enough access to healthcare? So at NH we have used a whole lot of technology trying to do that. Many years back we set up a telemedicine system around this. But subsequently, in the recent past, in the last 1 year, we have given that entire process a revamp, and we are working with like-minded corporates. HP Global has partnered with us in providing fully equipped telemedicine centers. We have now, at this point of time, around 22 such telemedicine centers, which are essentially primary centers connected to our nearest super specialty hospital on the HP cloud. So that is something we are seeing good traction, and where even people in the rural areas are willing to pay for healthcare. It is self-sustaining and it is a scalable models. So I think accessibility is important, affordability is important, and the third most important part is the partnerships. It is very important when as a healthcare provider, I can say that one is looking at providing accessible and affordable healthcare, especially on the CSR front, partnering with like-minded corporates, especially with the government across multiple states, is extremely critical. We have one such partnership with the government of Assam, which is for pediatric cardiac surgery for poor underprivileged children, and which has over the years now morphed into the first corporate hospital in the northeast with Narayana and NRHM and the government of Assam being part of it. So, these partnerships are extremely important, even with the private sector, the private companies using their CSR teams. We feel that the entire CSR models of affordability and accessibility can be really taken up to a different scalable level. Thank you.
Dr. Balaji from
Thank you, Mr. Jain, and there are advantages of being the last speaker. It's like a nice meal with the dal, roti, everything happening. What is left for the last guy? I take it as a challenge and an advantage because you can always provide the desert or the path. I'll try to keep it as like a guitar man as possible. I wear two hats. I'm CEO of Swasthaya, which is part of the Foundation, which is the CSR arm of the Piramal group. I have another hat called President Corporate Sustainability of Piramal companies. Now, what can CSR do is a question. I've been in this business since 2003, so almost 12 years now. I'm happy to see Susanto talk about 108. I'm sure whether he knows or not. I was involved in doing the first pilot of 108 in Hyderabad. The first proposal to Dr. Rajasthan'15 was written by me. And I'm happy when we saw the van that there is a chain stretcher that was born out of a traumatic experience that I had personally. And the chartered accountant friend of mine suffered a heart attack. I had to drive down 20 kilometers to his house, climb up, go in the lift. But we couldn't bring him in the lift because the stretcher was very heavy. We couldn't take him down and his hands were hitting the steps all around. Then I said, why can't we have a chair stretcher? This was designed by the mechanical engineers of Tech Mahindra, which was earlier known as Sasim Computers. The engineering services, they designed it. So the question that I asked myself is CSR is about bringing money alone, bringing the heart alone, or bringing something that corporates can do. Now, when we created 104, first time in this country, I went to NHS in the UK as head of social foundation. Asked them whether they can write that software to us. I went to the bidding board. They said, look, this is private software, you can't give it to you. I will talk with you. Then he said, Balaji, look, I can get the clinical algorithms done if you can get the software written. Because writing software is pretty bad. We export software to almost anybody in the world, no big deal. That's how 104 was born. So whether it's 108 or 104, both were born out of the same parent, called social governmenters. The parent abandoned us, orphan. The foster parents were then with EMRI, GVK. Foster parents for us, the Romans adopted us. So what did I learn? I worked in corporate for 2 decades as head of corporate strategy, head of the foundation, Success Foundation, and so on and so forth. What lessons have I learned? A lot of youngsters want to do something. A lot of companies want to do something. There are two kinds of things companies choose to do. One is checkbook charity. You need some money and sign it up and give it to you. Nothing wrong with that. It's very good. Giving money, making the purse strings open up is a good thing. But the second thing is, can you do something with the knowledge that you're giving the corporates to the social problems that they have? For example, some of the analysis that we was talking about when the calls happen in the night, etc. This is the data. Analytics are done in IT day in, day out for companies. For Citibank, they're interested in seeing who is buying on this credit card, what type of product. For Amazon.com, figures out every time you buy a book, you must say Balaji might be interested in these books also. So it's doing the pattern in the background. The clicks stream is looking at. Why is it not that capability of an IT company be brought to solve some of the social problems? If we can design GE's washing machine cups in an IT company in India, why can't the same capability come to improve the vehicles that we have? Solve the problem. Like you have seen, Mr. Omar Ashraf, who was the head of Jain GE's medical division, came to us. We asked him, in the morning people were talking about PLED. Everybody knows the power and utility of an ultrasound scan. But unfortunately, the way ultrasound scan is used in India, to ensure that girl children in the fetal site happens, we threw a challenge to them. Says, can you get an ultrasound where the genetic details of the baby are passed to the software program? I said, that's not possible, it's too difficult because the baby is moving all the time, the fetus is moving. Can you create a fingerprint and figure out who took the last one and trace that so that nobody can erase it? So if somebody in the government wants to know who has abused it, we can go track it. So again, do not belaboring the point. Corporates have capabilities beyond money. it may be few crores, but government has much more money. Nobody can spend it, the government can spend. And they have a mandate. They have a great architecture. They have a great mission to do something. I'm sure very committed people like Mr. Jain. I called him Dr. Jain in the morning. But I'm not a full doctor, that is the MBA, PhD. So I call myself a fake doctor as much. The question that, like I said, Shankara says, Vidya is Avidya. You were telling people, training is what people say. Because I don't know the medical field, I can ask all stupid questions. Because I ask stupid questions, this will be fundamental, which can solve some problems. Therefore, my invitation to myself and to the rest of the corporates who are there, what can a corporate bring to the table beyond money? For example, we did a Six Sigma project to identify and measure if you are running 475 vans in Andhra Pradesh, how many times did you miss? Out of 275,000 van days, we missed 35 days, that too because a couple of districts were under floods. So metrics can be very powerful. Can we bring that? Can we bring analytics? Can we bring design capabilities? Can we bring managerial practices? Can we bring in some of the best minds? Government cannot afford to recruit the latest current state-of-the-art people. Which private corporate can? Can we think of sending people on sabbatical to government? Like I used to work for a government institution. I was a professor in university. I went on sabbatical to an IT company for about 3 years. I learned about it. So similarly, can there be exchange of people, exchange of ideas, exchange of knowledge, exchange of managerial capability? Apart from structures like whether it's EMRI, HMRI, Swasthaya, which were created in institutions, these are things that probably will make a difference in healthcare. Because India, smallest state, new youngest state of Telangana, which I can see in the map, I'm sure in Telangana I will protest that, in the map. Telangana is about 40 million people. It's the size of a country, the smallest state that we have. So we need scale solutions. No single person, no single institution, no single organization can solve all the problems. And the context is so different, sir. When I started working, I thought I'd solved the problem the last minute I'll have in this man. Then we figured out that we went to Piramal Fortis. I had one old man, one baby, an 8th class child died. This is about death. We can easily avoid it. This died because of what? From small simple reasons of malaria or water and things like that. That is how we created in collaboration with some engineering companies a small box which we call dogs in the box, which anybody who is semi-literate can carry. It's a 2 kg box that they can carry into a travel area, which we know always not there. We went to our weekend. 6 hours or something. So these are problems are galore in this country, and every level there are different level of problems. At tribal level there are different problems. The ones that we find in Chhattisgarh are very different. We find in Sauras and Gadavas, in Odisha are very different, and so on and so forth. So my 2 cents worth of contribution here is, can we bring till 2004-2005, when at Satyam we started asking this question, how come there is not a single number? Because the death of my friend was travel accountant. I was driving down and asking Satyam, our operator, give me all the numbers of that. I had 120 guys, my wife was calling. Out of which one guy came last, he came 20 minutes late. So that is what led to us, saying that there is a single number. And of course, people like Venkat can join. He loved his number one, going to go out there and all that, and so on and so forth. What I'm saying is, these are obvious doable things that the world has already done. But this is a lovely space that we has created. We should thank them. I must also thank Mr. Jain for creating this space to share a few thoughts. I think it's just not money, it's CSR. It is technical capability, it is managerial capability, it is coming together. If partners like government and corporates trust a little more. Sometimes we make mistakes, sometimes we issues on the side. If we patiently learn from each other, I am sure India in just less than half a decade probably will cross any of the challenges that we otherwise have come to live with. And the commitment that the political will and the private capability that is there, India can easily solve. Because I always believe Indian bureaucracy works fantastically well in crisis. If you know Katrina, that happened in the US, and if you know tsunami that happened in South India, how well it was managed. It was all on straight. So I think we have enough as Indians to be able to solve our problems. It should requires partnership, it requires trust, it requires pardoning each other, forgiving each other, making mistakes. Together, hopefully, we will dream of India where we don't have to talk about basic things like IMRs and MMRs. Because we are all.
I have one basic question. I think some of you, one of you can answer that. It may not be correct because I have not read the entire section. But my confusion is, suppose I'm a company which is making good profits. I start a PPP with government, any government. And in the first year of operation of my PPP, I noticed that I have a loss of 1 crore per year in this PPP. Next year, I earned some profit in the last year, so I have to, spend 1.5 crore on CSR. So can I use my 1.5 crore CSR PT compensate for the loss made by me in PPP? Not exactly, by showing it directly to the people, but by just investing that 1 crore indirectly in the same activity in some other way, that I can make up the losses in my PPP by my fresh CSR. So is there a mechanism to check that?
I do not know the law, whether basically the law seems to allow you to carry the money to the next year in terms of spending money or not spending money. Typically, the government wants to name and shame those companies which don't spend money, because there is a special CSR company which has all these things which is supposed to review. There are two levels of governance that are there. One is the board, the second is the CSR company which is drawn from that. I'm not sure for other companies, but I can talk for the Piramals. The Piramals spend beyond what is needed in terms of the requirement of the law for CSR. Just to answer your one question, sir. They do subsidize a lot of work. We do R&D, we build software. There are a lot of senior management which is not good. I'm not asking that. I'm just fundamentally, therefore, I think it makes sense to do that in terms of investments, which cannot be shown as profits or losses, but definitely more than whatever the project.
Very key point in Kulshreshtha and policy says, if a corporate, whatever the profit they have earned for the last 3 years, out of that, the average, the next 3 years, you have to spend of it. So if you are making a loss and the amount you are investing, if you cannot have the sizable profit you are making, you cannot have 100 crore rupees project in 1 year in like 1 year. You have to make it in a period of time. So even if you are booking a loss, I believe you can book that loss because the profit will be next 6 years.
I think I should make it clear. I may be making 100 crore, but in a PPP project, a particular PPP project, I am making 1 crore loss. And I want to adjust my CSR on my 100 crore, which will come to 2 crore next year. I want to use that CSR to adjust my PPP in an indirect way by saying that I am investing in this activity 1 crore, which is actually saving my PPP losses. This is a technical mistake. Because you are running the show, I think. Because I doubt it. That's why I asked this question. Secondly, what I have found is that sometimes corporate sector, sometimes companies, they have their own issues. Suppose as an MD election, I approach a company. I ask them that this particular activity is not financed by my state government. This is not granted to me by Government of India. Can you please do this activity for me as your CSR? Then I have seen that certain corporate says, no, this is not our cup of soup, this is not in our list, we want to do this, we want to do that. And frankly, I have to make this statement for some of the companies which I have contacted. They say that they want to spend money on seminars, they want to spend money on trainings, they want to spend money on soap technologies kind of thing. But if I ask them that, I have identified 10,000 children in rural area and Government of India has given me 5 crore rupees for their treatment, but Government of India forgot to give me the transport to the hospital. So can you finance my transportation? I have 25 children, there is the hospital, but gap is transportation of those children to the hospital. I need 1 crore rupee in a year in the entire Rajasthan to fill that gap. So many companies have said, this is not our policy, and we can do the IC, we can do the training of your doctors. I don't need that. I want to have mango juice, but they are offering me apple, saying that mango juice also. So this is my concern. Actually, a lot of people will be having this concern, but I'm sharing my concern that sometimes companies may have their own wish list. And thirdly, there is again a doubt that whenever you are doing CSR, sometimes it is seen that maximum money they spend, they try to spend in their own area around their manufacturing facility, or where they are mining the minerals, or their operational area maximum they are spending. While CSR changes say that you can invest anywhere in the country. So there is an imbalance in that respect also. Suppose there is a backward area where there is no commercial profit to the corporate sector or to any corporate sector. Such areas which need intervention in form of CSR, they will never receive anything. So these are my questions. Any questions?
We as a corporate also see CSR as a social license to work, social license to operate. There was no policy and we are still doing it. So every corporate will definitely have a personal approach to serve the people getting access. So I do agree, sir, that this origin should go beyond the operation area. There should have a larger view. But end of the day, the business is fine. They are first priority to run the tax paper.
Previously, before the CSR became a mandate, it was like a value chain. Part of your value chain that you do activity there, you have a social inclusion of that area. Now that you have a mandate, you will go beyond your boundaries. So that kind of mindset also has to be changed in the this like grade 104, which is working in other and like you do the sanitation program. Maybe that success story can be replicated all across Rajasthan.
With the permission of Chair, I would just like to address your point of apple juice and mango juice. The fact of the matter is that the companies they work for in progression of 2 years, 3 years, 4 years plans. And suppose they sown a seed of mango, surely in next years to come they will be mango juice and we get only mango juices. It's a way of making the way forward. Today we sit here together and if we say what are the wish lists of the government and the companies, and if we share it out categorically that this would be planned for the next 3 years to 4 years, I'm sure we sow a common fruit, maybe apple or mango, and we get the same use what we sow today.
I think the last statement was the answer to the various things. That a company, if possible, can declare what would be its preference areas of activities where it wants to invest. And government can always have an institution at the state level or maybe at some maybe a district level or whatever regional level to actually tell the corporates that they want investment in these particular activities. Then such type of balancing can happen. And there was a question. There was a question.
There's something common between Mr. Roy and Mr. Tamboli which goes well with our trust Swasthaya, and then we are working on road accidents and how to save the life of a road accident victim. I mentioned this morning also. What I'm trying to say is EMRI is doing in collaboration. So we are going to the public. We are not inviting the public to the hospitals which they have. So our field is so limited, but it's very, very important. Because in case we are going to the public, it's difficult for us. So in case there's something common to collaborate with EMRI, according to CSR, they have pointed out a few things here. Promotion of road safety through CSR, promotion of education, educating at the masses and promotion of road safety awareness in all phases of road usage. And there's another thing, social business projects. Giving medical and legal aid treatment to road accident victims should be included. This is specifically spelled out here. So with these two corporates, our trust Swasthaya can really deliver something because it's 20 years old and we are really working in this field at the first stage in Rajasthan. Just a request for these two.
I see there is no other question, so we have completed the given target of completing the session in 1 hour. Thank you very much.
Firstly, thank you very much, sir. And I know it is one of your most favorite topics, corporate social responsibility. And it was a very fruitful discussion. Thank you to Chair and the other eminent members. Can my team get this mementos on the stage? I request respected Chair, Shri Naveen Jain, MD, NHM Rajasthan, to hand over as a token of thanks mementos to our eminent speakers. To start with Mr. Subrata Roy, Operations Head, GVK EMRI Rajasthan. Thanks to Mr. Roy and GVK for all the support. Mr. Tamboli, Director, Fortis Hospital, Jaipur. We also thank Fortis to contribute their support in this event. Mr. Kulshreshtha, Corporate Affairs Team, Cairn, India Limited. Mr. Gautam, Patel, Senior Policy Manager, Patel. Mr. Sumanta, Chief Marketing Officer, Narayana Health. And last but not the least, Dr. Balaji, Utla, CEO, Piramal, Swasthaya. I request for a group photo. While we move on for the next session, I would like to show a small movie to all of you.